Hello and welcome to this week's edition of NHIS in a Week. In the headlines, Tema NHIS office sensitizes health providers on my NHIS app. Nicholas Boama, 11-year-old boy, donates 14,000 Ghana cedis to the NHIS. Kofi and NHIA organize training program for staff of the authority. To our first story, the Tema Metro office of the authority has organized a sensitization exercise for health providers in the Tema enclave on the use of the My NHIS app. The innovative platform was launched earlier in the month by the Vice President to augment the other traditional method of registration onto the scheme. Prior to the launch, the project committee went round to educate staff of the authority across the country on the use of the app. Speaking to the administrator at the Tema General Hospital, Madam Rejoice Kemevo praised the authority for the timely introduction of the innovative platform.
The training has been so good, more especially in relation to my app, my NHIS app. We all try our hands on using the app, and it's very useful. You can sit in your home, wherever, and then do all the transactions that you're supposed to do on NHIA app. So I may say that it's been so helpful. Yes. Initially, working at this facility, for instance, the OPD gets crowded most of the times because people want to do renewal of their cars. But for now, we don't have those challenges anymore.
Now, the manager of the Tema Metro office of the authority, Madam Lydia Aqua, said the training was important as it will make the operations of the health providers easier and more efficient as they attend to members of the scheme.
Oh, so far, it's been very, very encouraging. As you can see, the interaction with the providers is great. Currently, they are being taken through, trying to practicalize it themselves and see how the app works. So it's been great.
The National Health Insurance Authority and the Korea Foundation for International Healthcare, KOFI, are working on developing a curriculum that will enhance operations of the authority. The project lead, Mr. Xavier Ando Ejay, said he was optimistic that the training will meet the desired result.
Thank you. Can you tell us what this NHIA Kofi Health Insurance Learning Center is all about and why it's important?
Yeah, thank you, my brother. The Health Insurance Learning Center came as a result of a successful implementation of a project that we had with the Korea Foundation for International Healthcare from 2013 to 2018. And that project was basically in the Volta region. So after a successful implementation, they developed the interest to continue to help health insurance. So they asked us to look at other areas that they can also help. So we were looking at something that will benefit the entire staff within the NHIA as first targets, and then health insurance credential providers, and then also the private health insurance, and of course, any civil society organization who is also into health may also take advantage of that. So we requested for the development of a health insurance learning center, but we call it knowledge sharing center, where we can share knowledge in that center, not only among ourselves as staff, but also with other sister countries in Africa. You know that countries like Tanzania, Zimbabwe, Zambia, and co have been coming to Ghana to understudy the health insurance system. So we thought that we needed to have something like that. That will serve first and foremost as a continuous professional development for the staff.
The project manager for Kofi Foundation, Mrs. Priscilla Ameni-Ampon, said the training will help build the capacity of staff and position the authority to achieve universal health coverage by 2030.
I have been a beneficiary of Kofi's learning experience. I think it was a program in 2015 in Addis Ababa, and I was part of that program, so I know of Kofi. But for Kofi's collaboration with NHIA on this project, can you tell us from Kofi's perspective what you're hoping to achieve from this collaboration for Ghana's NHIA?
Okay, thank you very much. What Kofi has done so far with NHIA since 2013 is to help to strengthen its operations to achieve the universal health coverage. So we have done a lot, through this we have done a lot of capacity building. As you said, you have also benefited from some of the invitational trainings in Africa. We have also done our best to send over 40 people from NHI to Korea, South Korea, to learn about the NHI experience in Korea related to the NHI system and HERA in South Korea. So what we have achieved so far is to see that the first phase of improving on the coverage has gone into a level where we have come into a system whereby to share knowledge, whereby we are establishing a center with the University of Ghana.
Moving on, Master Nicholas Boama, an 11-year-old boy and founder of Books Without Borders Foundation, has donated 14,000 Ghana cedis to the National Health Insurance Scheme. The donation is to help register and renew children onto the scheme. A check was presented on his behalf to the CEO of the NHIA at the headquarters of the authority in Accra. Last year, Master Nicholas Boama made a generous donation of 9,000 Ghana cedis to help register children onto the scheme. According to Nicholas, he was always concerned about the health care of children and therefore decided on his own to raise money on his YouTube channel to help in this cause. The decision to donate to the scheme, according to the 11-year-old, is because of the services the NHIS provides in ensuring access to health care. This year's donation of 14,000 Ghana cedis was presented on his behalf by the host of Kids Arena, a television show on TV3. The CEO of NHIA, Dr. Bernard Okuboy, received the donation on behalf of the authority.
Books, yeah, 2,000 plus. And when you register 2,000 people, that's 2,000 lives covered, you know. And when you cover one life, when you go to heaven, you get a lot of crowns. So we thank you very much for coming, and it's our belief that others will also learn from this, you know. If kids can raise thousands, the adults should be able to raise millions. You know? It's a challenge. So since the kids arena is doing all this, the adults arena, you should also do something. Yeah, you got to learn.
Now, owing to the global economic meltdown, the National Health Insurance Authority has stepped up efforts to sustain Ghana's private health insurance industry. Among other pragmatic steps initiated by the authority, the governing board and management met with industry players at the head office in Accra. In his welcome address, the NHIS CEO, Dr. Bernard Okuboy, reassured stakeholders, saying the authority is ready to help make their work more profitable based on their efficiency. Moving on, stakeholders from the healthcare sector have called for closer collaboration between private health insurance companies and the National Health Insurance Scheme to deepen universal health coverage in Ghana. The call was made at the Maiden UHC Day seminar, which was organized by Nationwide Medical Insurance in partnership with Farm Access Foundation. The one-day event was under the theme, Achieving Universal Health Coverage, the Role and Contribution of Private Health Insurance.
I want to commend the organizers of this event for such a well-chosen, timely, and fit-for-purpose theme. Distinguished ladies and gentlemen, it has been more than half a decade when the United Nations General Assembly adopted a set of 17 wide-ranging sustainable development goals to be achieved by the year 2030. The Agenda 2030 highlights the need for a more integrated and inclusive approach to development to ensure that no one is left behind. The SDGs are pivoted around these three major dimensions: economic, social, and environmental sustainability.
A training exercise seeking to highlight challenging customer behaviors and effective ways of managing them has been extended to some districts in the Greater Accra region. The ongoing training is empowering NHIS staff to sharpen their skills in customer service experience and how to capture their actions to create lasting impressions amongst the National Health Insurance Scheme. A team of facilitators from the NHIS Corporate Affairs Directorate in collaboration with Training and Development Department led by the Client Services Manager, Ruth Kukwa Intumi Coleman, engaged NHIS staff in the Ashedu Keteke, Beshi, La, and the Dangbe West District offices. Now to our final story. As part of NHIS month celebration, the board and management organized a staff hangout to climax this year's activities. Here are some highlights.
Today's gathering is most important to us as management because we have to strengthen the bond and team spirit. And so to our hard-working staff, especially those in the regions and the districts, management in consultation with the governing board is determined to reduce the operational challenges and create a conducive workplace for us all. We are very much guided by the fact that the more motivated you are, the more productive we can be as an institution. And I plead with you not to rest on your oars. In spite of some apparent attendance difficulties we have to deal with, the governing board, executive management, and staff have contributed to some achievements in the year 2022. Mr. Chairman, ladies and gentlemen, ensuring maximum security for our staff across the board, management sees that as a top priority. So management is working assiduously to provide adequate parking space within the head office premises.
Far, I think that we as a family, we are doing well and will continue to do well so far. So I'm thanking you all as staff because as we speak, approximately 18 million Ghanaians are enjoying medical cover as an insurance because of all the hard work that we have put in. As we speak, over 1 million Ghanaians who attended the hospital over the past 12 months have had their bills or claims paid by this authority, this scheme, because of all your hard work and input. As we speak, over 5,000 providers, that's medical or health facilities, are still in business because of all your hard work. They are still operating and working because you have remained at post, giving of your best, sacrifice to make sure that they are reimbursed for all the hard work. As we speak, hundreds of kids with cancer are receiving treatment, all because of the hard work that you have put in. 80% of all childhood cancers now are covered. It's the first time since 1957 that we have such a situation.
Let's go! Let's go! Let's go! Let's go!
Now, this is how we wrap up this week's edition of NHIS in a Week. Have a Merry Christmas and a prosperous New Year. Afi Shiapo, Afi. See you.